It covered unique skin concerns. It covered also cultural significance and advancements in research and technology. And it also covered, or covers, the conclusions of how we should handle the diversity in dermatology and cosmetology. Which one is the button now? Focusing on the rich diversity of dermatology across the different cultures, regions, and ethnic groups. And I'm specifically saying ethnic groups because based on the research that has been done in every area, it's always on one group. And I'll tell you as I go along what I mean by that. Our goal is to understand how biological, cultural, and regional factors influence skin conditions and treatments worldwide. So, skin health is an integral part of the overall well-being, affecting physical comfort and psychological confidence. Dermatology aims to address these concerns, but often lacks cultural and racial inclusivity. Recognizing and understanding diversity is crucial to delivering effective and equitable care. Today, we will examine differences in skin biology, cultural perceptions, challenges, and innovative solutions around the world. So, skin biology varies remarkably across the globe. Melanin pigmentation that protects against UV rays, which is why closer to the equator tends to have darker skin. Genetics play a role in skin thickness, elasticity, susceptibility to certain conditions. Environmental factors like pollution or climate impact skin health and disease prevalence. Recognizing these variations is key to effective diagnosis and treatment. This is a map here showing, based on where you are in the equator, what happens with skin health. And so you have the native Central American peoples, you have the Aboriginal Australians, you have the Central Indian peoples, and so on and so forth. Skin tones. Now it's funny, it starts here with level 2 all the way to level 6 or 7 in skin tones based on what part of the world or your ethnicity. This would be the Fitzpatrick scale that we use a lot when measuring how our treatment system responds to certain skin conditions. Melanin plays a great role, the melanocytes play a great role in terms of the skin condition, and so on. Now, the levels from light to dark skin tones. Genetic factors significantly influence skin resilience, healing capacity, and healing capacity. Genes dictate the production of structural proteins, like collagen and elastin, which are crucial to skin elasticity and strength. Variations in these genes can make some individuals more prone to conditions like stretch marks and slow wound healing. Additionally, genes play a role in skin type, sensitivity, and response to environmental factors like sun exposure, ultimately impacting how skin heals, how skin ages and heals. Now, people who don't believe in climate change and so forth, they are a little bit off the rockers. Because the way the world works now, all of the carbon monoxide we put in the air can affect, how skin performs or behaves in certain geographical regions. Some countries are more contributing, first world countries are more contributing factors to skin conditions, and the smaller countries like SIDS, small island developing states, tend to bear the brunt of it because they don't pollute the air as much, but they get a lot of the consequences of skin conditions based on what's happening in the region. So there are many factors to consider. Environmental factors like I discussed, exposure to whether it's sun or different types of temperatures that climates in different regions. This is the skin patches, Fitzpatrick skin type regional. So you have a type 1 here, not necessarily the best picture of her, but and as you see it goes down. And it tells you what happens. Now these normally go by, I would say, the homogeneous functions approach to the skin. So if you are Celtic, Nordic, Latin Mediterranean, Asian, or African, the skin is different based on the eumelanin or pheromelanin level. Ethnic and cultural differences. Certain skin conditions are more prevalent differently and based on the ethnicities. For instance, keloids can be more common in individuals of African ancestry. Melasma, characterized as brown patches, often affects women of Asian or Latin American origin. Additionally, cultural perceptions of beauty influence how conditions are viewed, and some cultures have long-standing traditional skincare practices, rice mask in Asia, and camel milk in Africa. So these, and then you have vitiligo, which, vitiligo is a skin condition we'll talk about a little more. That affects, is seen more in people of darker skin types. Okay? Keloids, if you don't know what keloids are, this is what keloids look like. More common in black or darker skin. May occur after a severe acne, ear piercing, and if you see people walking with extra ear, those are their keloids that have to be removed. Any type of skin injury, such as a cut or puncture wound, the size and shape may vary depending on the part of the body that they appear. You can have them from, even when you have a port put in your chest from chemo or from cancer, when you remove that, it creates a keloid that sometimes has to be removed. So you have different types of skin conditions. Treatment options include surgical removal, and a array of non-surgical options include corticosteroid injections and cryotherapy. Sometimes doctors recommend a combination of both based on so that it doesn't return. Melasma, it says the skin condition, causes brown patches on the face, often on the cheeks, nose, forehead, above the upper lip. It's a type of hyperpigmentation, meaning the skin is darker than usual. Melasma is more common in women, especially during pregnancy, and often triggered by hormonal changes and sun exposure. Vitiligo. So if you notice, vitiligo is a chronic condition. It's an autoimmune disease where the immune system attacks melanocytes in the body structure, in the integumentary system, and it affects the color. So, but if you notice, if you're darker, it shows more. We have an example of Michael Jackson, if you know who he is, who he was. He had the condition. Many people didn't believe it, but he actually did. And he did other things to even out the skin. I mean, he's a famous person, so he doesn't want to walk around with vitiligo. But if you're light the skin, so the people with lighter skin who have vitiligo, but you don't notice as much because of the high skin tone. Treatments for keloids include steroid injections, silicone gel sheets, and so forth. So you have the steroid injections, you have silicone gel sheets, you have silicone dressings, and then you have cryotherapy. So there are quite a few therapies that are recommended by dermatologists or dermatological surgeons for the reformation of the skin. Laser therapy also can be used to flatten the keloids and help them fade. Surgical removal of keloids can be an option, but reoccurrence is common when you do the surgery. It is often combined with other treatments like radiation therapy and steroid injections, like the corticosteroid we spoke about earlier. Radiation therapy, low-level X-ray radiation alone and after surgery removal can help shrink and minimize keloid tissue. Other therapies are bleomycin injections, imiquinol creams, and pressure therapy may also be used, but the effectiveness vary. And the effectiveness vary based on the type of keloid, the size of keloid, and the pigmentation of the skin. Then you have melasma, have topical creams like hydroquinone, retinoids, corticosteroid, also used to lighten the melasma and reduce hyperpigmentation. Laser treatments, resurfacing, laser resurfacing, laser genesis can help improve melasma by targeting pigment. Chemical peels, also professional chemical peels, can help to exfoliate the skin and reduce hyperpigmentation and severe melasma. Other treatments, tranexamic acid, along with medications, also can also be used depending on severity of melasma and other patient illnesses. So the challenges. Despite the diversity, most dermatology research historically focuses on lighter skin, leading to gaps in knowledge about conditions present in darker skin. This can cause misdiagnosis. I think we had a discussion about that last night.
Yeah.
Delayed treatment and effective interventions. Additionally, language barriers and cultural differences can hinder effective communication and engagement. Accessibility remains a significant issue globally, especially in underserved populations. If you notice, when I asked the doctor earlier about research or treatment for people, he said he had no stats because he was not exposed to that. So that tells you that it's still a long way to go for us to understand global skin health, not just one group of people. And I'm using the word ethnicity as opposed to race because a lot of times we tend to confuse race with ethnicity. I think the only two races, black and white. You can say brown. But ethnicities determines what cultural or geographical background you're from. So I tend to, and then now you have the homogenizing, if that's the right word, of all of these homogeneous groups. You have, or maybe pasteurizing might be better, where you're finding more heterogenes, where you have an Indian marrying a Chinese, or a black marrying a white, or so you have all these mixtures. So nobody's really a genuine, authentic skin type anymore. You may have two different levels of skin in your DNA, and your phenotype, you can't change that really. So that's a whole other story, which I won't talk about in much detail. Doctor will tell us more about that. So research, predominantly on lighter skin, and that's what happens. I find that when they do a lot of these researches, even when I'm getting data from other groups or companies, they only have one group of people that they do the research on. It's always lighter skin people. And they don't go into areas of darker skin types, I'll just say that, for them to collect data. And all the research is not as, and I think one of the reasons why they don't do it is because financially, they don't think that some of those groups can be targeted to a certain price point to make money from. So that can play a role, which we'll talk about a little bit. Then you have different things that can cause keloids. So you have, blackheads are not that bad, but when you have cystic or pustules or those things, or even scars here, you can get keloids from, maybe overexerting the skin. And a lot of people who have a lot of these conditions tend to want to pop them themselves. It's a natural thing. You have a pimple in your face, you want to pop it. As a child, I used to do it a lot. So I know. And you do it for a while, depending on the sensitivity of your skin, you can create something that looks like a keloid. Advances and innovation. Recent advancements include developing skincare products that are targeted to hyperpigmentation scarring prevalent in darker skin, using AI tools capable of analyzing diverse skin tones for accurate diagnoses, and increasing participation of diverse populations in clinical trials. Culturally sensitive education for healthcare providers improves patient outcomes. So when you have, and that's why we have to sometimes, I try to indicate when I do any sort of